Hello, welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. Today, we have an episode about medical knowledge and how do doctors find info that they're looking for? How do they find information differently than us non-medical people Googling for medical information? How does a doctor do that? Hello, Dr. Sherman.
Nice to see you.
See you again.
Here. Thank you.
Yes. All right, so I think I'll just start off with that very question. How does a doctor, I guess, look for information that they don't currently know?
The best way is through their own medical journals. We know about textbooks and we know about reference books and things like that, but you want to tailor your knowledge to your particular area of interest, your particular experiences. And so the best way to do that is through medical journals. There are two ways to really approach that. One is to subscribe to various medical journals within your specialty, and every week or every month, depending on how frequent the journal is, you'll get it delivered to your home or office. And in each issue are particular studies and updates on disease states and ways to treat, ways to approach. So that's very good, especially within your own specialty. You read an article, do patients benefit from medication X in this condition? Do patients, what are the symptoms of disease X after, there's specific questions that you're answered. So in that regard, you get the journal mailed to you or whatever, and you can learn as you go ways to improve your style of practice of medicine. Alternatively, did you want to ask a follow-up on that? Sure, go ahead.
Yeah, I was just going to ask, so is that information, I guess, more up-to-date than other sources?
Right, so these are journals, these are journals that are up to the minute and most recently published. The data is, hot off their research patients and stuff. So that's good. Alternatively, you can, if you have a specific question, like, when you get the journals mailed to you, whatever they're in there is in there. So you got to just absorb whatever information they have. But if you have a specific question, is ultrasound the best test to order in a patient with disease X? Or in an endoscopy, do you take a polyp out this technique, or do you just take it out the old-fashioned way? Or do you inject it? Is it better to burn it, or is it better to, remove it, with a forceps? So you can do a search, and the doctors have access to Medscape or online search engines tailored to the medical journals that will direct you right to the question you want answered. Now, that's the question you want answered, but to your question from before, it may be a year, 18 months in the past. I mean, it's not going to be right, but nonetheless, you look at the studies and you make your own decisions based on the data. And they'll all, any search you do will pump out the most recent study first, and then take it after that. So it's like it's like the Google for doctors is Medscape, or Medscape's the one I use. There's some other ones I can't remember off the top of my head, but they'll direct you right to the articles in the journals that will answer the particular question that you're asking.
Do these happen to be publicly available websites?
They might be. I'm sure they are. They cost, and if you're not a physician, sometimes these journals are maybe speaking to you a little bit over your head. So I don't know how much the general public would want to be in on these anyway.
That's true.
But and I'm not. That's no disrespect to people who aren't doctors. I'm just saying the way medical data is presented is a particular way. I mean, in med school, there's courses, and we learn how to, journal club, and we go over articles all the time. It's not like we it's an acquired taste, these medical
Exactly.
journals. So
There's just words
these
used
so
that are not usually used.
But yeah, I think they are available. And at the end of the day, there's the introduction and the conclusion, right? I mean, there's a lot of in between, but the introduction, does this medicine work? We looked into this in this hospital population. Skip all the meat and potatoes of it. Go to the conclusion. No, this medicine didn't work because it was, so you can kind of jump around, but it's good to know the in between part too, and that's where you do a lot of learning with the Medscape and the online.
All right. One brief thing that I need to mention that I forgot to mention in the intro was the count of COVID-19 data currently in the U.S. Currently, there are 3.4 million cases of COVID-19 in the U.S. and 137,000 deaths. And those numbers are very large. And of course, if you've been looking at the news at all, things have been getting quite a lot worse, and it's only going to get more worse. And that just means that we have to be more precautious from now on. Anyway, so back to this topic.
The numbers. I think the numbers are they're skewing toward the younger folks who were going a little bit more out and about while things were open there for a while. I do think the older folks are staying home and staying out of the way. We'll watch the data on deaths and ICUs and things like that to follow. Hopefully, we can bend this curve a little bit. It's tough. We just got to stay the course, and we just need some good leadership.
And I think what's important for those that just don't understand, just don't know how epidemiology works, is essentially it takes time for people to die from an infection. We know when someone gets infected with COVID-19, but it may take weeks or even a month for them to actually die from it. Right. Which is why the death count might be a lot lower than you would think.
Yeah, death count will trail the infection rate. It's just the nature of it. So we'll see what the death rates do. Hopefully they'll stay level. I mean, that's the whole thing, or go down.
So I know that a lot of people like to use WebMD. Like when they Google whatever question about medical stuff, WebMD is usually one of the websites that come up. I guess how reliable is WebMD?
It's pretty reliable. It's pretty good in terms of the facts of what the question is being asked, but and so you'll say, you'll type in, abdominal pain, right side, and the best it can do is in its search keywords bring up things that can do that, and what it's presenting is probably true and it's been in textbooks. Where you run into a little trouble or ambiguity is, I mean, it's a whole clinical picture.
Okay.
Pain on the right doesn't, and then you look at the list of things and you end up with pancreatic cancer at the end of the day. But you're a person with habits and yeses and nos to questions that the computer can't ask you that a doctor can, and a physical exam that the computer can't give you that a doctor can. So, but the facts that you're getting are probably okay, but out of context, they're probably not as accurate and helpful as they otherwise would be, So it may not necessarily, it's not going to apply to the person looking up what's on WebMD necessarily. It'll spit out a bunch of facts, but that doesn't mean you've got all those facts. So you got to know, patients got to know, or people when they're looking things up got to know that it's not one size fits all, and sometimes you can get a little bit even though there are facts, they may be impertinent or not relating to you, and it may give you a little bit more stress or anxiety than you otherwise would need.
Exactly, because for one thing, it doesn't. I haven't used WebMD in a while, but I don't believe it lists right next to the symptoms the like percentage of people who have those conditions with those symptoms.
Right.
Right, because like obviously it lists like every possible condition that could create that symptom, which is where you get things like the range of pancreatic cancer to, I don't know, like a muscle tear.
Right. Yeah. Yeah. Exactly. I mean, that's a good way to separate it out. But
Exactly. So you can see all the possible things.
Physical exam. I mean, does it hurt when you do a sit-up? Does it hurt when you eat? Does it hurt when does it wake you up at night? The computer's not asking you that, so it's not tailoring or whittling down what it's gonna
Exactly.
answer, what it's gonna spit out back to you. It's just you're gonna Google, right-sided abdominal pain, and out comes a list of things that you probably don't have. But the list is accurate because in many cases, right-sided abdominal pain does apply to whatever it's telling you. It's just one little part of a bigger picture,
Now it seems that the problem with the website, or not really the problem with the website, but what's lacking from just using the website is whittling down, like you said, with questions about just more information than just a symptom. Does there happen to be a website that's already doing that, actually? Like maybe there's some other niche website that actually has you answering questions to whittle down.
You mean a more interactive website? Perhaps.
Yeah.
I don't know myself. I mean, I never Google or WebMD something. So I don't know what alternatives are out there in terms of interactive websites that could, if the computer's asking something back, for example,
right.
Or if that website is programmed to. Now there may be some that have a chat guy, a doctor or something out there, but I'm not familiar with that. I get mine from the journals and conferences and experience.
What I just realized, or what I just made a connection, is that the technology for that kind of deduction actually exists, and I know it exists in at least one place. And there's actually, what's funny is that there's like this little game website called Akinator. Basically, it's just a computer that asks you a bunch of questions, and the computer deduces a celebrity or a pop culture figure that you're thinking of. So like you think of, I don't know, like Batman, right? And the computer is going to ask you, is this like a male? Is your character you're thinking of male or female?
Yeah, it's like 20 questions.
Exactly. And it keeps going. Like that eventually it'll ask, like, is this in the DC universe? And then it'll whittle down and give a guess. Right. And I think that's exactly the kind of deduction that could be used for medical stuff, where it asks you, what did you do in the last couple days? What did you eat? Does it hurt when you sit up?
Yes and no questions, probably. Yes and no questions. It can kind of, the algorithm, yes, no, move on to the next thing, yes, no.
Exactly.
And, go
and then
on.
Give a set of possibilities. So it exists out there. It's possible.
Yeah, no, it's true. And that would be a great tool. And trust me, I mean, I love it that patients are curious and that they want to know and want to learn. And if they've been to a doctor and want to learn more about maybe what the diagnosis is and learn what they can do and what they should eat or how they should, any lifestyle changes they should make based on a diagnosis that's reached, and that's great. And they can, ask the important questions. It's just when, you got to just be careful that, I have this pain, or a black spot on my arm, and they end up with melanoma. I mean, you got to know that's not the way to go, but you got to ask the more detailed questions.
Exactly.
and learn a little bit about something. But you're going to get a lot of incorrect information. The information's correct. Does it apply to this patient? Looking it up, it does not, and that's where the confusion sets in.
essentially,
and then, these websites that can ask you and whittle it down, that would be good. I'm going to look into that as a potential, suggestion or resource tool to maybe give patients that they can, when they want to know a little bit more about what's going on or have other questions that even maybe I couldn't answer for them, to get a little extra information that way.
Maybe if I knew HTML website programming, I could create that myself. But that's another opportunity. So essentially, it's kind of don't jump to conclusions too quickly when you're given this information, because a non-doctor person just trying to learn more about medicine, of course, you have to acknowledge the fact that you don't know that much. And I'm not trying to say I'm not trying to like patronize you or anything. It's just that's just how it is, and simply being aware that's how it is actually goes a long way, because you're able to keep yourself open to new information.
Exactly.
Because something that you might think is true, well, if you're open to new ideas, then you'll more easily accept what is actually true or other processes.
Yeah, and you want to just keep an open mind, and take what information you can acquire in the context of your own symptom set, complaints, and lifestyle things, and use it to just learn a little bit more about how to approach things, and not necessarily assign yourself a diagnosis or a 6 months to live death sentence kind of a thing.
Right. And it's not like you shouldn't learn stuff. It's just be careful, be aware.
Exactly. And the doctor's always available for your as a resource too. But you want to you want to listen to the doctor and not you can ask questions, of course, but don't and take the information as you want. Patients sometimes want to just only hear what they want to hear, and
then it's like, why are you going to the doctor?
The doctor's telling them what they don't want to hear, and that's not the way to go about it. You got to absorb all facts as
exactly
in terms of getting information online, in person, or however.
Exactly. And this is, of course, it is a complicated dynamic, because second opinions exist. It's just, calling it a second opinion, I feel, is almost a little unnecessary, because it's really just the act of just going to another person, another doctor, and asking what's wrong. I feel that too often second opinions are there for reasons like you said, of patients want to hear what they want to hear. But obviously you can't.
Right. The patient didn't like the advice of the first doctor and wants the doctor to say something else, so they go to another doctor to find that out.
Right. And that can be exploited. But,
I don't know.
And that can be exploited, but it's
and the doctors should I think good question on second opinions. There may be a practice out there. I can't prove it, but there may be a practice out there for doctors to have each other's backs, and for the second opinion to agree with the first opinion, just to not throw the doctor under the bus. But I bet the good doctor will, if it requires disagreeing with the first opinion, they should, whether the patient wants to hear it or not. Sometimes the patient will not want to hear two differing opinions, and it will go for the third opinion. Just have to be honest with the patient. Tell him or her what you believe is the right thing, and the patient will use that information as they want, however they want.
Exactly. Yeah, I think that actually reminds me of how you really do have. I'm not trying to be patriotic or anything, but you do kind of have a lot of freedom in that you can just go out, because really doctors, they give advice. they also practice medicine, but but they also give advice. And it's not like the doctors are forcing patients to really do anything. It's just telling a patient what they should do.
Correct.
And if the patient go along with it, and if the patient doesn't go along with it, well then, all right, you can go down your own path.
Yeah, I mean, there are the patients who will do whatever it says. Oh, I'll do whatever it takes. This is bothering me. Or they're like, well, I'm not really a medicine person, so I'm not gonna take the medicine. I'm gonna do my own thing. Fine, whatever you want to do. I'm just, my advice is to take the medicine. I prefer not to hear back from you 3 weeks later saying I'm still hurting. I'm going, well, but you haven't been on the medicine. I know, but I mean, well, then take the medicine. I mean, that we see that a lot. But most patients will take the advice. We've been looking for information on their patients' cases, and we're given advice based on their reports, research we've done, physical findings, laboratory analysis, and we would tell the patient, this is what you need to do. And, most patients would, go along with it. Oh, you need this test. Oh, you need this medicine. I think we should do this because we can find this out. I always explain things. That's another thing. If the patient can get more information from the doctor in verbal and thinking through the plan, they're more likely to take your advice. You have this finding in this, so because of the way that works, we need to do this medicine. And if the medicine works, great. If not, we'll do this. And put a big bow around it and plan. Because if they're informed and the patients get the information that way, they'll go along with the advice. That's kind of how I do it. Instead of just spending 5 minutes with the patient, oh, you got this. Here's a prescription I got to go buy, and they're like, wait, but and you can't. And then they're not going to take the medicine because they have questions that weren't answered, and they're not getting the information. Right.
And that's pretty much a good representation of what can happen. For me, I personally love learning about medicine, so I'm always very interested to learn whatever the doctor has to say about it. Obviously, there's some people out there who are also who may have some kind of busy schedule, or they just tell me what to do. That's it. I'm going to leave now. But then, of course, a doctor can be like that as well, because doctors live busy lives, I believe.
Yeah.
Yeah. And
some busier than others. I mean, some want to be at work all the time. Some will be at work a lot of the time, but some are. You can't pry them away from the office. It's great for them. That's not my style. I cut the end of the day off and go, okay, time for something else for right now.
And it's good to take breaks because that is exactly makes you more efficient. Now, what's funny about the talk about basically on the advice, take it or leave it kind of approach, it for most part for patients' individual concerns that works, because leaving the advice usually only really hurts the patient, and it's well, you didn't take the advice, just do whatever you want to do, I guess. But in the case of this COVID-19 pandemic, the advice of the advice of wearing a mask isn't really take it or leave it, because not wearing a mask is going to endanger other people. And that becomes
that's the difference on that.
Exactly. That becomes a public health
concern. That's not an option. If you want to not take the medicine and put yourself in, give yourself a harder time recovering or work on a different way for your own body, go right ahead. But if you start to endanger others by making decisions carelessly, that's a different story. So that's not an advice. It's kind of, you can make that a mandate or a, ordinance or whatever, that you got to wear a mask when traveling outside. When you're out of the home, because that's a public health thing. That's not a personal
Exactly.
It's a public health thing.
Same thing with vaccines.
People to get a flu shot, if they want to get their, it's a different thing. If people don't want to get a flu shot, that's up to them, because they'll get the flu, and whether they get the flu shot or not, they'll still spread it. However, but when it involves others, that's a
exactly. And even in the case of the flu shot, if somebody
different category,
if somebody doesn't get a flu shot, I believe that's mostly a problem on their part, but not really public health concern, just because the flu shot is available for everybody. So if somebody wants to be protected from the flu that someone else didn't get the flu shot, then they can get the flu shot.
Right. Yeah. So if you don't want to get a flu shot because you don't believe in vaccines or whatever, go right ahead and do that. That's your own personal decision. The advice of the doctors is to do it because the flu is not it's not always just
it's not harmless.
Recovery in 2 days. It can be trouble.
Yeah, the flu is not harmless. just put it that way. It's not a cold. We've been over that in like other years. Like a couple of years ago, there was that really bad one. Now we have a comment from the chat about how they like to check the CDC website and the NIH, and that reminds me about the NIH. The NIH, I've been on there before as well. Is that kind of like one of the journal websites that you've talked about?
No, I think that's just the National Institute of Health's home site, which probably has some links and resources of its own. And same with the CDC or the WHO or any of those areas that have some information you can obtain from those websites, maybe the topic of the day or the topic that is pertinent of the times. But what I was referring to are basically search engines for medical journals. Medscape, as I mentioned, and I used it so many times that I forgot the name, but there's another one like that where it's Google for medical journals. The NIH might link you to something like that, or can link you to other things, other societies, websites. For example, I'm a GI doc, so there's the American Gastroenterological Association website, which is a source of information. There's the ASGE, the American Society for Gastrointestinal Endoscopists website. There's the ACG, American College of Gastroenterology. All these websites are the societies, meaning you can join them, go to their conferences, but also they have pertinent information up on the website, maybe some recent data that has been not necessarily brought into journals, but are like on the verge of. When you go to the other websites that you look for actual journal articles, the search will bring up actual journal articles. When you go to these other society websites, it's like abstracts and emerging data that may not have been published in journals yet, but it's still looking promising. You can kind of use that information also. And that's open to the public too. If you want to look into that, those websites may be a little bit, fancy or above your head, but it still it can be a useful set of information. But the NIH, WHO, CDC, they have medical information on there, a little bit different than the others.
Okay. We have a question from the chat about the types of tests that are the focus for diagnosing COVID-19. They mentioned the reverse transcription polymerase chain reaction or the rapid antibody-based test. I guess which test is primarily being used?
The PCR, the polymerase chain reaction, is the one primarily being used. That's the nasal swab deep to the high up into the nose. I had one of those tests done a couple weeks ago. Despite, I didn't tell anybody I was positive, but I just went out and did my own thing and coughed all over the place. Nobody knew, so it was nobody. No, I was negative.
Yeah.
That's the PCR. That's the most accurate test. The other test is pretty accurate, but when we're talking about pre-op and wanting to know exactly, the PCR is the best. Molecular base is more of it could be a swab on the inside of the cheek, a little more of a superficial nasal swab. Those are okay, but a little less accurate, more room for some false negatives. And false negatives are rough because the patient's told he's negative, and then he goes out and doesn't wear a mask, but is not negative actually, right?
Exactly. So the antibody test, I believe, would be important into detecting if people are actually immune to the virus. They had to have had it But of course, there's all this concern that people are not keeping their immunity.
Right. And the antibody tests are not super accurate. They're kind of accurate, but not as accurate as we would like. So
Okay.
the value is still not great. There's still a lot of false positives, I should say, where
Okay.
you are told you have it and I have really not had it. As more and more people get the virus, the number of false positives will come down. But at this stage, it's still too many to be comfortable with that
Exactly.
antibody test. If you have a negative result, then that's okay. I mean, then you can pretty much assume you didn't have it, and that's okay. It's when you have a positive that still may be a decent chance that it's really not positive, but you have no way of knowing that. That's why that test is a little bit inaccurate, and should be taken with a grain of salt, or maybe not even gotten in the first place.
We have a really good question from the chat about, do you happen to know a website where it cites the clinical proof, I guess, that masks work? So some people can have that on hand, I guess.
I saw an article yesterday that cited it. I don't think I have time on the conference now, but I will get that to you. That there's an article that showed that the transmission from mask to mask, from mask person to mask person, is much lower than one person not wearing it from either side. The data is now showing that wearing a mask, a typical surgical covering,
exactly one of those,
can be protective to the wearer.
That's impressive.
And that's what I will get
exactly
up to the to the link soon. That'd be good. Just wear the mask and we can get through it. It doesn't keep the virus in you. If you've got it, if you're an asymptomatic carrier, you don't know you have it, and you're wearing a mask, the thinking is it's keeping the virus in you and then making it grow. It doesn't do that. It doesn't do that.
Right. The amount of viruses that you're outputting is actually very insignificant compared to the amount that's in your body if you are infected. So it's not like inhaling those viruses again is going to make your condition worse. Most of the viruses are in you. And I think
if you're wearing a mask, the virus has to get through layers. So even if it does get inside, if you weren't wearing a mask, let's say 50 million viral particles would get in. If you're wearing a mask, 5 million would get in, and that 5 million is not going to cause nearly the infection 50 million would. In fact, 5 million may not cause any, and you would be asymptomatic and not know you even have it. And as long as you're wearing a mask, you won't spread it. So that's another way to squash it. You won't get it so bad, you won't spread it. Done.
Before we end off the show today, I would like to bring up a little bit more about how the masks work. Essentially, they don't technically block the viruses directly because the viruses have to be sitting on water droplets through the air. That's correct.
It's the droplets, right? So the droplets have to get through the mask, and some aerosols can do that. Some very fine. The larger droplets will just kind of fall to the ground. Those are the heavier ones. The aerosols, which are lighter, can circulate in the air a little bit. Those are the ones you got to be careful of. But that can be, especially outside, blown away very easily and not worried about. But it's those small droplets that can get through the mask and infect, the patient, or the person wearing the mask. However, as I said, the mask makes it difficult for that to get to you, and instead of so many, much fewer are getting through, which will result in a much less severe, infection if it turns out to be an infection.
Exactly. And the types of water droplets that we're talking about, for example, if someone were to breathe on their hand, or how they breathe on glasses to wipe it off, we're talking about those kinds of aerosol water droplets, right? The kind that you get when you
small ones. The sneeze are the bigger ones. Cough are bigger ones. The vapors in your exhaling, you lose water every time you exhale, you're losing water, and it's those water droplets that contain the virus that,
Exactly.
if forceful or enough, can get. Now, if you're wearing a mask and you do that, it either gets caught in the mask, or it leaves to the side and drops off the side. It doesn't go very far out.
Exactly. In
And
fact,
so
I'd imagine.
you lose. That's what you're doing when you're cleaning your glasses. You're breathing out. You're losing water, and in that water is the virus.
I guess that would kind of, like, you know how when you're wearing a mask, your face around the mask can sometimes get kind of sweaty, get condensation, get a lot of water. I mean, that's actually the point, I guess, to keep the water there instead of the water out there where other people can receive it.
Yeah, and you're breathing and you're losing, so that the condensation's coming from your mouth, sweat on your skin. I don't know what I don't know what the virus if there's sweat, if there's virus in sweat. I don't know. Okay. I would imagine not, but I don't know.
Luckily, we're not usually.
That's another reason it's all contained anyway.
Yeah. Luckily, we're not usually flinging sweat at people, so that's not actually like a huge concern.
Yeah, but what the NBA is starting next week, so watch out.
Oh, that's true. We will. All right. Yeah. Well, that concludes our episode of Ask the Doctor with Dr. Sherman. We hope you learned a lot about how to get medical information and how doctors conduct research. If you would like to give us a question, you can email us at myworldsciencetv@gmail.com. And if you want to schedule an appointment with Dr. Sherman, he's in the LA area. His email is in the chat, cowardgastro@gmail.com. And until next week at 3 p.m. Thursday, probably. Sometimes we do 4 p.m. for other scheduling reasons.
Yeah.
Until then, stay safe and wear masks.
All right, indeed. Thank you, and we'll hopefully these